Hello, Dr. James Bogash, expert in health and longevity, and in today's review, there was a study. There's no doubt that maintaining both cardiorespiratory fitness and muscle strength is critical for all things health and longevity. But what about cancer patients? Certainly the idea would be that it would be no different, but unfortunately this is not stressed with people who are undergoing cancer. A lot of times the thought process is like diet, appetite may fall, and so doctors may recommend really crappy meal replacements made by like big pharmaceutical companies that really are just crap, but doctors are just interested in getting calories in without thinking about the quality and what kind of an impact that has on body composition. So before I go into this study, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So that being said, this was a review of 42 different studies looking at almost 47,000 patients. So this is a big study, and these were cancer patients. And they looked at both muscle strength and cardiorespiratory fitness. Muscle strength was measured by something as simple as hand grip strength, and that's at least a good measure in studies. It's not the end all be all. It's not like you can train hand grip strength and everything's going to be fine, but likely hand grip strength is a reflection of how strong a person is. And then the other one was cardiorespiratory fitness, and that was tested either by by a cardiopulmonary exercise test, where you're on a treadmill and they keep increasing the speed until you kind of tap out, or a 6-minute walk test and like how far you can walk in that time frame. And they looked at two things, both all-cause mortality from likely of these cancer patients dying from anything, or from cancer-specific mortality from, let's say they had prostate cancer, dying from prostate cancer. So what did they find? Not surprisingly, cardiorespiratory fitness and muscle strength, when combined, when people were higher levels of that, 46% lower risk of dying in the length of these studies. That's massive. And it makes you think that the first conversation we should have as in oncology is not what chemotherapy we're going to do, not what surgery, but how are we going to keep you fit throughout the course of this process. And that also goes to the conversation is also how fit are we going into this process, and that's an argument for always maintaining good cardiovascular fitness and muscle strength. So, and that with the associations with cancer mortality, the strength was strong with both early and late stage cancer. So maybe even if you started late, you started in the cancer journey with exercising, the more fit you are, the better the outcomes are. This is powerful stuff. And we're not talking about diet, we're not talking about sleep, we're not talking about targeted supplementation or chemo or radiation. We're just talking about staying fit, both from a muscle strength and a cardiorespiratory fitness standpoint. And obviously, from my standpoint, I maintain or continue to promote the idea of a short burst, higher interval or high intensity interval training type thing for cardiorespiratory fitness, as well as weight training for muscle strength, resistance training. No matter what age you are, we need to do something to be building or maintaining our muscle mass. So, as always, I'll post the link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.